Have you ever walked into a room and, just for a second, forgotten why you went in there? Most of us laugh it off as a senior moment, and most of the time that's exactly what it is, nothing more than a busy mind or a bit of tiredness. But there's a difference between everyday forgetfulness and something more persistent, something that creeps in so quietly that families often don't notice it until months, sometimes years have passed. Today, we're going to talk about 7 of these subtle, silent signs that can sometimes point towards the early stages of dementia. Signs that are easy to miss because they don't look dramatic at all. They look like ordinary life. This matters enormously for anyone over 60 and for the people who love them, because early awareness genuinely does make a difference. It gives families time to plan, time to seek support, and time to explore treatments and lifestyle changes that can help manage symptoms, or in some cases, address other treatable conditions that mimic dementia entirely. So if you're watching this because you're a little worried about yourself, or about a parent, a spouse, or a close friend, take a breath. This isn't about frightening you. It's about helping you notice, understand, and respond with clarity rather than fear. Let's talk briefly about why the brain becomes more vulnerable with age. As we grow older, the brain naturally undergoes changes. Blood flow can become slightly less efficient, the connections between brain cells can weaken over time, and the body's ability to repair minor damage slows down. For most people, this simply means a little more time needed to recall a name or a word, nothing that interferes with daily life. But for some, these natural changes are accompanied by other processes, changes in protein build-up in the brain, reduced communication between nerve cells, or vascular changes affecting circulation that can gradually affect memory, reasoning, and behaviour. It's important to understand that dementia is not a single disease, but an umbrella term for a set of symptoms caused by several different underlying conditions. And crucially, forgetting where you left your glasses is not the same as forgetting what glasses are for. That distinction matters, and we'll come back to it throughout this video. Let's begin with the first sign, and one of the most overlooked: subtle memory lapses that affect daily functioning, rather than isolated forgetfulness. Everyone forgets a name occasionally, but when someone begins forgetting recent conversations entirely, asking the same questions several times within a short period, or relying heavily on notes for things they once managed easily, this is worth paying attention to. The key difference lies in whether the information is eventually recalled. Ordinary aging might mean the memory returns later with a little prompting. In early dementia, the memory of the event itself may simply not be there to recall. Family members often describe this as, "It's like the conversation never happened." If you notice this pattern building over months rather than days, it may be worth discussing with a GP. Not to panic, but to rule out other very common and very treatable causes, such as vitamin deficiencies, thyroid imbalances, or the side effects of certain medications. The second sign is difficulty with familiar tasks. This might look like a person who has cooked the same recipe for 40 years suddenly struggling to follow the steps, or someone becoming confused while using the television remote they've used every evening for a decade. It's not about learning something new and finding it difficult. That's completely normal. It's about losing the thread of something that used to be automatic. Loved ones sometimes assume the person is simply not concentrating, but if this becomes a consistent pattern rather than an occasional slip, it's a signal worth noting gently and kindly, without judgment. The third sign involves language, specifically word-finding difficulties that go beyond the usual tip-of-the-tongue moment. We all pause sometimes, searching for a word, but early cognitive changes may cause someone to substitute odd or unrelated words, lose track of a conversation partway through, or repeat themselves without realizing it. A person might call a fork the eating stick, instead of simply forgetting the word temporarily. This is different from typical age-related word searching, and again, patterns matter more than isolated incidents. The fourth sign is disorientation with time or place, even in very familiar settings. This could mean losing track of the day of the week more than occasionally, or feeling confused about the season despite obvious clues, or, in more advanced cases, momentarily not recognizing a familiar street during a regular walk. It's worth remembering that mild disorientation can sometimes stem from other causes entirely: poor sleep, certain medications, dehydration, or even an infection, particularly urinary tract infections in older adults, which are well known to cause sudden confusion. This is precisely why medical assessment is so valuable. Confusion has many possible causes, and a proper evaluation helps identify the right one. The fifth sign is difficulty with planning or problem solving. This might show up as trouble managing household bills that were once handled with ease, difficulty following a familiar recipe with multiple steps, or losing track partway through a task that requires sequential thinking. Family members often notice this before the individual does, because we naturally adapt around our own struggles without fully realizing it. A gentle, supportive conversation, rather than criticism, tends to be the most helpful response if you notice this in someone you love. The sixth sign relates to mood and personality changes. This is one of the more misunderstood early indicators, because we tend to associate dementia purely with memory. But changes in the brain can also affect emotional regulation. This might present as increased irritability, uncharacteristic anxiety, withdrawal from social activities the person once enjoyed, or subtle personality shifts, such as a previously easygoing person becoming more suspicious or on edge. It's essential to remember that mood changes can also arise from depression, chronic pain, hearing loss, or simple loneliness, all of which are common in later life, and all of which deserve compassionate attention, regardless of the underlying cause. The seventh and final sign is misplacing items in unusual places, combined with an inability to retrace steps. Everyone loses their keys occasionally, but placing the television remote in the refrigerator or becoming distressed and unable to logically work back through where they might have left something is a different pattern altogether. When this is paired with accusing others of moving or taking items, it often reflects confusion rather than genuine suspicion, and understanding this can help families respond with patience rather than frustration. Now, here's something crucial I want every viewer to hold on to. None of these signs, on their own, means dementia. Each one can occur for entirely different, often very manageable reasons. Stress, poor sleep, certain medications, thyroid problems, vitamin B12 deficiency, depression, hearing difficulties, and infections can all produce symptoms that closely resemble early cognitive decline. This is precisely why self-diagnosis, whether about yourself or a loved one, is never the right path. A proper medical assessment, which may include blood tests, a cognitive screening conversation, and sometimes imaging, allows healthcare professionals to understand what's really happening and to rule out reversible causes before considering anything more serious. If you do notice a pattern, rather than a single moment, forming across several of these areas, the most helpful next step is simply to have an open conversation with a GP. Bring specific examples rather than vague concerns, such as, "She's asked me the same question 5 times this week," or "He got lost driving home from the shop he's visited for 15 years. Specific, concrete observations help clinicians enormously. While no lifestyle change can guarantee prevention, because individual risk varies enormously based on genetics, medical history, and factors outside our control, there is meaningful, encouraging evidence that certain habits support brain health as we age. Staying physically active, even gentle, regular walking, supports blood flow to the brain. Maintaining social connections helps keep the mind engaged and can ease feelings of isolation. A balanced diet, rich in vegetables, whole grains, and healthy fats, along with good hydration, supports overall physical and cognitive well-being, Prioritizing quality sleep allows the brain time to consolidate memories and clear metabolic waste. Managing blood pressure, cholesterol, and blood sugar levels supports healthy blood vessels throughout the body, including in the brain. And keeping the mind engaged through reading, puzzles, music, or learning something new appears to offer some protective benefit, though results vary from person to person, and none of this should be seen as a guarantee. As we bring this together, let's recap the heart of what we've discussed. Subtle memory lapses that affect daily function, difficulty with familiar tasks, language and word-finding changes, disorientation in familiar settings, challenges with planning or problem-solving, noticeable mood or personality shifts, and misplacing items combined with an inability to retrace steps. These are the 7 silent signs worth watching for with care and compassion, not fear. Remember, many of these symptoms overlap with other very treatable conditions, and only a qualified healthcare professional can offer a proper evaluation and peace of mind. If there's one thing I hope you take away from today, it's this. Awareness is not about anxiety, it's about empowerment. Noticing these patterns early, gently, and without judgment gives you and your family the best possible chance to seek support, understand what's happening, and make informed decisions together. You don't need to carry worry alone, and you don't need to wait for a crisis to start the conversation. A small step today, a phone call to a doctor, an honest chat with a loved one, can make all the difference tomorrow. If you found this video helpful, please give it a like, and if you haven't already, subscribe to Senior Health Insights so we can continue bringing you clear, compassionate, evidence-informed health guidance every week. Please share this video with anyone in your life over 60 or anyone caring for an older parent or relative. It might be exactly what they need to hear today. And do leave a comment below. We'd love to hear your own experiences or questions, and our community is here to support one another. This video is provided for educational and informational purposes only and is not a substitute for personalised medical advice, diagnosis or treatment from a qualified healthcare professional. Please consult your doctor regarding any concerns about your health or the health of someone you care for.